Hello everyone and welcome again to our weekly health talk with Dr Waine. Thank you so much for your time today, Doctor.
Thank you, Lebo. Thank you very much.
Very exciting today. We'll be talking about women's health, particularly pregnancy. Very exciting topic there. Could you tell us some but advice on pregnancy especially?
Yeah, one of the things that I kind of like see, and it also has an impact on the health system of this country, as they say, the biggest killer is about women pregnancy-related deaths, and that's called maternal mortality. And the statistics matters. It's about 700 ladies that die in every 100,000 in the country. So that's a lot. That's the highest amongst the Pacific and maybe top highest in the world of top 5. So we do have this problem, and one of the things we realize is that ladies, they come in unplanned pregnancy, and then the subsequent events that happens during pregnancies. So the planning wise has to take place right before the pregnancy starts. And when I say planning, basically includes like when you should have the baby, and what you should go about doing your pregnancies, whether the LCT is very close by or it's far that you need to move around, you need to, all this logistics wise. So this is part of the planning anyway. So they need to do this planning, and so how many times they need to go for the clinics, and if in the process where there is some problems happens during the course, what's the backup plan? You need to be at the hospital, and how you need to get to the hospital. There's a planning that needs to be done, but a lot of the ladies and a lot of the couple, that's including men, the husbands and the partners, they don't have this planning. It's by ad hoc. And so when it happens, everything is just taken up by ad hoc. So we go by whenever it happens. That's where we see a lot of these ladies having problems during pregnancies. And so sometimes as much as possible, we try to save the mother than the baby when there's a situation like this. So it always puts unplanned circumstances and situations, put doctors and healthcare workers, some kind of stress.
Ad hoc.
So that's where one of the things we advocate is that ladies must have, with partners, the family thing. Have a plan before pregnancy, and during the course of the pregnancies, we ask them to come to the hospital or any health center very quick on the first, when the lady misses 2 or 3 months of their pregnancy, of their period or menses. Then the next thing is to get tested to say that you're pregnant and how the baby is doing.
That's right.
So it's very important in terms of planning pregnancies, and especially when it comes to antenatal. This is when you start going for checkup for the pregnancies.
Okay, so apart from attending regular antenatal clinics, what other advice in terms of maybe diet? Is that something that's important?
One of the other things we see is that during pregnancy they are always having problem with hemoglobin, the quality of blood. So they're anemic. A lot of these mothers in the country, in the rural areas especially, they're anemic. So because the babies, if you look at the other side, it's a parasite. It's feeding from the mom. So mom needs to be strong to give that the strength to the babies. So however the baby is, the mother is also important. So the mothers are encouraged to eat proper meal and diet, so that in terms of the blood levels and anything, immunity of the mom is very important for the baby too.
That's right.
So everything else, mother is also important. So mothers are encouraged in terms of dieting, a little bit of exercises, and general personal health, which also has some implications on the baby, the developing, fetus.
Well, definitely healthy mother, healthy baby.
Very important, very important.
Great. Thank you so much for your time today, Dr. Waine. Pleasure having you on the show.
Definitely. Thank you very much for people having me on board, and thank you.
Thank you.